Now, the New England Journal of Medicine has posted an editorial blasting the failures of U.S. President Donald Trump's administration on the coronavirus. It says Americans should vote them out in November. The editors write that the U.S. has failed a crucial test of leadership during the pandemic. And they say the magnitude of this failure is astonishing. And they also fault inconsistent and too late lockdown measures after the disease has spread substantially in many communities. And they slammed the loosening of restrictions long before adequate disease control had been achieved. The editorial lambastes U.S. leadership over the politicization of masks and for the politicizing the development of a vaccine. And earlier we spoke with Dr. Gary Richwald, an infectious disease expert based in Los Angeles, about the significance.
Well, I think that this story broke today, and for those of your listeners who don't know, the New England Journal of Medicine, sometimes called NEJM, is probably the most prestigious and of scientific medical journals in the world, and that's not an America-centric comment. I think that reflects the 175 years of publication and the outstanding and attention to detail and to honesty and truth. They have never endorsed a candidate. This is not an endorsement of a candidate, but it's when you ask people to vote out the incumbent, it's essentially an endorsement of the new candidate. So I think what's very difficult and what was brought up in the editorial was when we have a situation where masks work, social distancing works, quarantine and isolation work, and yet we have a president who is questioning and in some sense transferring facts, those are facts, into opinions, and then those opinions get, you're on either one side of the opinion or the other. This makes it very difficult to conduct healthcare. I mean, it's bad enough when people read things on the internet that are wrong and doctors have to spend time sort of addressing those issues. I think that's what's expected. But having that level of misinformation coming from the top, from the president and from all of his minions, I think that is a way more than most doctors can handle.